58-year-old man with a 15-year history of type 2 diabetes mellitus presents for a routine eye examination. He reports occasional blurry vision, especially in the evenings, but denies significant pain or visual disturbances. His blood glucose levels have been poorly controlled, with an HbA1c of 9.5%, normal 5.7%. On eye examination, the ophthalmologist notes microaneurysms, dot and blot hemorrhages, and signs of retinal neovascularization. There is also evidence of macular edema. Which of the following is the most likely diagnosis, and what is the underlying mechanism? A. Hypertensive retinopathy, retinal vessel occlusion and ischemia due to elevated blood pressure. B. Diabetic retinopathy. Chronic hyperglycemia leads to retinal vessel permeability, microaneurysms, and neovascularization. C. Age-related macular degeneration, retinal degeneration due to aging and genetic factors. D. Retinal vein occlusion, occlusion of the retinal vein leading to hemorrhages and edema. E. Papilledema, increased intracranial pressure causing optic disc swelling. Correct answer? B. Diabetic retinopathy. Chronic hyperglycemia leads to retinal vessel permeability, microaneurysms, and neovascularization. Explanation. 1. Diabetic retinopathy. Pathophysiology. Chronic hyperglycemia in diabetes leads to damage to the retinal blood vessels. This damage occurs through multiple mechanisms, including increased permeability of retinal vessels leading to microaneurysms, hemorrhages, and exudates. As the disease progresses, retinal ischemia can lead to hypoxia, stimulating neovascularization, the formation of new, fragile blood vessels. Stages of diabetic retinopathy. Non-proliferative, background, diabetic retinopathy, characterized by microaneurysms, dot and blot hemorrhages, and hard exudates due to leakage from the vessels. Proliferative diabetic retinopathy results from chronic retinal hypoxia, leading to the formation of new abnormal blood vessels, neovascularization, that are fragile and prone to bleeding, leading to vitreous hemorrhages and potential retinal detachment. Macular edema, due to the leakage of fluid from the abnormal vessels, leading to blurring of central vision. Risk factors: poor glycemic control, long-standing diabetes, hypertension, and hyperlipidemia. 2. Why not other options? A. Hypertensive retinopathy. While hypertension can cause retinal vessel damage, leading to retinal hemorrhages and edema, the pattern seen in hypertensive retinopathy differs from diabetic retinopathy. Hypertensive retinopathy typically involves arteriolar narrowing, flame-shaped hemorrhages, and optic disc edema, without the microaneurysms or neovascularization seen in diabetic retinopathy. C. Age-related macular degeneration, AMD. AMD involves degeneration of the macula, leading to central vision loss, but it is not associated with microaneurysms, hemorrhages, or neovascularization in the way diabetic retinopathy is. AMD typically presents with drusen and can have wet AMD with choroidal neovascularization, but not the same vascular changes seen in diabetic retinopathy. D. Retinal vein occlusion. Retinal vein occlusion can cause hemorrhages, edema, and macular involvement, but the primary cause is occlusion of the retinal vein rather than chronic hyperglycemia and the resultant microvascular damage seen in diabetic retinopathy. This is typically associated with venous dilation and cotton wool spots. E. Papilledema. Papilledema is associated with increased intracranial pressure, leading to optic disc swelling, but it does not cause microaneurysms, hemorrhages, or neovascularization in the retina. Key takeaways for USMLE. Diabetic retinopathy is a chronic complication of diabetes due to hyperglycemia, which causes vascular damage in the retina, leading to microaneurysms, hemorrhages, and neovascularization. It progresses in stages: non-proliferative, microaneurysms, hemorrhages, and proliferative, neovascularization, vitreous hemorrhages. Macular edema may cause blurry central vision. The mainstay of treatment is strict blood glucose control and laser therapy for proliferative retinopathy and macular edema.